Hello again, welcome to Psychology 303, Analysis of Everyday Behavior, and today we're going to be talking a little bit about positive punishment and some of the ethical concerns with utilizing punishment as an intervention technique. So in the last video we talked a little bit about negative punishment, talked about using timeouts and response cost as different techniques we can use to reduce undesirable behaviors. But now we're going to shift into positive punishment, and this is what we should use as an absolute last resort. We could use it instead of extinction along with reinforcement in some way, but using positive punishment alone is a last resort. It's something that we ideally don't want to end up having to use. So with positive punishment, we're applying some kind of aversive stimulus, aversive consequence after every instance of an undesirable target behavior. This could be applying some kind of undesirable activity, forcing someone to do something they don't want to do, or application of some kind of aversive stimulation. And we'll get into a little bit about what each of these are. So what does it mean to apply an averse activity? Well, there are several different examples or techniques that we can use. One involves overcorrection. So the positive practice version of overcorrection is that after a certain undesirable behavior occurs, you have them go back and re-perform the behavior, but in a more desirable way. So an example of this would be a child getting out of the pool and running towards mom. Well, as a child, you're not supposed to run around the pool, you're supposed to walk. So the mother would say, all right, hey, you're not supposed to run, go back, get in the pool, get out and walk over here this time. So forcing the child to do something that they probably don't want to do. But in this sense, it's kind of replacing that undesirable behavior with a more desirable behavior. So getting the child to practice a more positive behavior than that negative behavior that they just performed. A different version of overcorrection is what's known as restitutional overcorrection. This is when after a person performs an undesirable behavior, you have them fix the situation, not only in that specific instance, but also more generally. So what do I mean by that? Using some vague terms there. So a great example of this would be a child drawing on a desk in a classroom. The teacher catches them. Not only do they force the child to clean what they did, the drawings on that desk, but they also force the child to clean all the other desks in the classroom. So kind of returning the environment to a better state after that undesirable behavior. So forcing the child to do something that they don't want to do, which is clean all the desks in the room, should be the punisher and should reduce the instances of that behavior occurring in the future. So those are some examples of overcorrection. We can also have something known as contingent exercise. This would be forcing someone to perform some kind of undesirable or aversive exercise after each instance of the problem behavior. So this is commonly used in many of the military services, Marine Corps, Army, Navy, etc., as a way of getting rid of some of these undesirable behaviors. You did this incorrectly, you didn't clean your gun correctly, you're not in correct uniform, drop and give me 20. We've probably heard that phrase before. So using push-ups as an aversive activity, an undesirable behavior that a person has to do after this undesirable target behavior should reduce the frequency of that behavior occurring in the future. And lastly, we can have what's known as guided compliance. This would be forcing or trying to get someone to perform a specific behavior. They don't. So instead, you kind of guide the individual through performing that behavior. So as a punishment, you may want, say, a child is throwing a tantrum. You punish them by having them clean their room. Well, they're not budging, so you slowly kind of guide them through the process of cleaning the room and then slowly shift all that behavior onto them. So it's a way of getting people to actually perform the behavior, maybe raking leaves outside as a form of punishment, but you don't just throw them into the deep end. You help them a little bit and then let them take over and take basically the brunt of the work and the brunt of the punishment on their shoulders. There are some other techniques that can be used, not used very often in ABA, only in kind of some really serious situations, and that would be physical restraint. We especially see this type of averse activity used when people are performing a behavior that is self-stimulating. So oftentimes, especially in some kind of autism spectrum children, we see them hurt themselves, punch themselves, hit themselves in the head as a form of self-stimulation. Well, sometimes we can use physical restraint to prevent that from happening as a form of punishment to not only prevent that behavior from occurring in the future, that would be response blocking, but to also put them in a non-desirable situation, a non-desirable activity. If they know that that's going to happen after every instance of self-stimulation hitting themselves in the head, then the likelihood of that behavior occurring in the future should be reduced. So those are examples of aversive or averse activities. We can also have averse stimulation. This would be any kind of stimulus that hurts us in some way or is undesirable in some way. So physical stimulation, spanking, electric shock, maybe an averse noise that hits our ears, an aversive taste, anything that attacks our senses in some way, stimulates our senses in a way that we don't want. That can be used as a form of positive punishment to deter some of these behaviors. So for example, a child throwing a tantrum, you might say, all right, because you've done that, now you have to eat broccoli, which you hate. Or now you have to eat Brussels sprouts, or now you have to have lemon juice squirted in your mouth, or now you have to smell this really bad smell. That's an example of positive punishment, but applying an averse stimulation. So as I mentioned, this should be a method of last resort. Only if reinforcement, extinction, DRA, only if all of those methods fail, or if those methods are too slow or inappropriate to change the behavior. So sometimes you need to change this behavior very quickly if it's a very harmful behavior, such as that kind of hitting yourself or maybe cutting yourself. Obviously, you want that behavior to stop as soon as possible. Sometimes using more drastic methods initially can help to reduce that behavior occurring in as fast as possible, basically. And there are obviously some risks that you need to take into account when using positive punishment. We've talked about DRA and how that's great because you're learning more desirable behaviors. Positive punishment doesn't do that. It just focuses on that undesirable behavior. It's also ineffective unless it's contingent on every single instance of behavior. Then people think that they're just being punished or abused for no good reason. They can't put two and two together and realize, all right, I need to stop doing this in order to avoid those abusive punishments. Sometimes people can get habituated to the abuse or to the negative punishments. That's also a problem. You don't want the target individual who's trying to change a behavior to habituate to some of these averse stimuli or averse activities that they have to do. Not only is that not good for someone's psyche, but it's not good for the actual intervention as well. Those punishments are not going to be as effective if people are getting used to them. And additionally, escalation to abuse is also possible. We focused a lot on the person receiving the punishment, but this is also impactful for the person delivering the punishment, and they can end up kind of traveling into a cycle of delivering this type of abuse, whether it be physical, psychological, to the other person, and they can kind of get used to it himself. They can kind of habituate to it, and that can lead to have some serious consequences as well. So obviously those are some of the risks, and some of these ethical concerns obviously apply to positive punishment, but they also apply to using negative punishment as well. And it's especially important if you do find to be in a situation where you're at a last resort, you have to use punishment in some way, or you have to try to use punishment. What do I need to make sure I'm aware of before I start implementing the strategy? Well, you need to let the target individual know exactly what's happening. They need to be aware of, all right, this is the situation. If you perform this behavior, this is the punishment that's going to be delivered. So I encourage you to not behave in this way. You don't want to trick the individual at all. They need to be completely aware of what's going on. The individual needs to be aware that they are in a safe environment. You don't want to use any kind of positive punishment that's going to have some serious safety issues or serious consequences. Again, you're focusing on the behavior, not on harming the person, so you need to be careful. You need to determine what type of punishment you want to use and the magnitude of the punishment because the punishment should fit the crime, so to speak. You don't want to use a very intense or severe form of punishment if the behavior you're trying to change is something relatively menial. You may want to up the punishment if this is a serious issue, such as hurting yourself or cutting yourself, for example. And lastly, people who are actually implementing this punishment intervention need to be accountable for what they're doing. There should be other people who are aware of the intervention that's being used. There should be some kind of peer review used to make sure that everything is ethically sound. There should be training and supervision for people who are implementing the punishment. People need to be aware of if certain types of punishment are being used, when that might be going too far, and when to stop using that intervention entirely. So people need to be well-versed, well-trained in how to use this, and there needs to be some kind of accountability involved. So that's all I have on punishment. You can probably guess some of the reasons why I didn't have punishment as one of the intervention strategies you can use for your first behavioral modification project, because there are a lot of issues with punishment. We ideally, as ABA specialists, don't want to utilize punishment unless it's the last resort. So hopefully you have a much better idea of punishment and how it compares, especially to reinforcement. Thank you all for your time and attention with this video, and I will see you all next time. Bye.